My name is Dr. William Craig. I am in private practice in San Antonio, Texas. My practice, Craig Cardiovascular Center, has offices in San Antonio as well as in 4 rural communities south and east of San Antonio. For several years, we have utilized remote monitoring to assist with the management of advanced heart failure patients. This retrospective study demonstrates that remote management, combining efficient clinical workflow patterns and in-home monitoring equipment, facilitates guideline-directed medical therapy and results in improved patient outcomes. Because management of heart failure is a dynamic process, periodic office visits are insufficient to optimally assess and adjust medical therapy and lifestyle. However, real-time, daily data collection and review allows for proactive adjustments of medications and more rapid progression to optimal guideline-directed medical therapy. Prior studies have yielded mixed results about the benefits of remote monitoring for management of heart failure. These studies used different monitoring tools, showed insufficient patient and/or clinician compliance, and failed to integrate remote patient management into daily clinical workflow. This study shows that real-time, data-based, proactive adjustments of medications and lifestyle utilizing remote patient management improves compliance, decreases outpatient office visit, and reduces hospitalizations. 40 patients with New York Heart Association Class II or Class III heart failure with both reduced and preserved ejection fraction were enrolled in this retrospective study. A significant number of patients had comorbidities of valvular heart disease, atrial fibrillation, or chronic kidney disease. All patients were provided with a wireless tablet computer as well as a Bluetooth-enabled weight scale, blood pressure cuff, and pulse oximeter. They were asked to transmit daily weight, blood pressure, heart rate, and pulse oximeter data, as well as answer a few questions about symptoms. Data was transmitted to the secure online Cordella clinician dashboard presented as trend plots. Workflow patterns were established to allow daily monitoring of this data by a cardiologist or clinical nurse. Based on the data, patients were called to adjust medications, verify symptoms, or titrate medication. Responses were monitored and further adjustments made as indicated. Patients not requiring medication changes were contacted regularly to assure them they appeared stable and to inquire about clinical status or symptoms. All patients were monitored daily over a 2-year period. The total number of office visits, emergency room or outpatient IV diuretic visits, and hospitalizations were documented for this 2-year period and compared to the 2 years prior to enrollment into the study. Patient compliance with daily transmission, reporting 5 out of 7 days, was initially 90% and increased to 95% at the end of 2 years. This proactive remote management system led to significantly improved outcomes. Emergency room or outpatient IV diuretic visits decreased by 93%. Hospitalizations for heart failure decreased by 83%. These results were achieved with a 6-fold increase in phone calls to patients for medication adjustments, titration of therapy, or checking on clinical status. Routine office visits, however, decreased by 14.5%. In summary, this retrospective study demonstrates that the use of remote patient management technology with efficient workflow patterns facilitates exceptional patient compliance as well as optimization of guideline-directed medical therapy. The significant reduction in emergency room visits, heart failure hospitalizations, and routine office visits is achieved by proactive optimization of medical therapy, improved patient compliance with medication and lifestyle, and a better understanding of their disease process. Ultimately, patients may have less morbidity and increased longevity.